Assalamu alaikum wa rahmatullahi wa barakatuh. This is a guideline for the correspondence course that we are giving you for the part 1 examination. The part 1 is composed of only 2 papers, and these 2 papers are, one is an MCQ, the other one is a SBA, short single best answer. And we'll give you a half set every week for 16 weeks, and the topics also will be given at the end of that, after with the explanation. You will try to follow the guidelines, and if there's any subject that you want to be revised again, if you're not very sure, you will have to mark it in your feedback form. I'm going to give you a special feedback form which you will use after correcting your marks. You can correct the marks yourself. That will give you a better insight to where you went wrong. And in the meantime, I would suggest to you, you take your clinical, we will also give you the GTG guidelines, the NICE guidelines, and my hospital where I work about 2 weeks a month, which is in the UK, the Royal Sussex University Hospital guidelines. If you take these guidelines and practice on your patients, especially if you are not practicing in the UK, you better practice in your patients and regularly go through and discuss with your senior colleagues, and therefore you will understand how to manage the patient. Most of the questions are based on clinical approach and your clinical management policies, and these are given in these 3 guidelines I send you. I've also sent you the curriculum modules and the matrix. Now I want you to write down interesting cases for yourself to remember, so that how you manage the case, and also interesting clinical situation which you discuss with your colleagues. And we will also send you some hot topics that may come for the exam for the part 1, and part 1 is only theory. And if you know the subjects that are coming, and if you know the subjects that are likely to come for the exam, you will pass the exam. But you must every week do the exam at the beginning of the week, answer the questions, correct them on your own, and then feed me back with saying what are the types of questions you faced and how you scored in that, and what are the ones that you are not very sure of. So we'll send you material for you to read. And the general topics, once a week I will give you a video presentation of 1 or 2 topics on a video site where you can sign in and log in. I'll give you the login names for you. And with good luck, and if there's anything that you require, I'm available to you 24/7. So you can either email me, or if you see me on Skype, you can call me on Skype. All the best to you. You can always contact my office if you don't get at me. They will answer you as well. Assalamu alaikum wa rahmatullahi wa barakatuh.